So thank you much for joining us. And I think we can get started immediately, just given that time is a bit tight. And we'll start off with you, James. What are some of the challenges that healthcare institutions face when integrating CX strategies, and how have you tackled these at Life Care hospitals? And also, how does digital transformation impact patient care?
Um, Good morning, everyone. Thanks, Bona Moses. The healthcare space is it gives me a deja vu moment, and you heard of the story of Kensel and all that, and personally, I feel I live that deja vu moment in healthcare. Um, Data silos are huge when it comes to in the healthcare space, and that is a great challenge in itself. And maybe to bring it closer home, if you visited a facility, a clinic, and some tests were meant to be done for you, so I can really guarantee you that over, say, 90% chances are that the tool that is going to generate your results will be very different from the facilities system. And so more than likely that they would have to maybe manually or in one way or another transfer that data. Data silos in healthcare are huge, and that is a great challenge in itself. We also have silos in the sense of resistance from professional perspectives. These are people who've gone through years of learning, doctors, nurses, you know. So when it comes to also trying to change them to adopt also customer experience practices and standards, ladies and gentlemen, I can tell you it is quite a challenge. I like to tell a story way back when I was young, and probably in that intro, I should have just simply said, I have 40 years of healthcare experience because my parents are both from a healthcare background. But I recall going to see my dad when I was a child, and there was a lady seated at the end of her office, of his office, and she had a typewriter. And she had this beautiful typewriter that you will put paper, carbon, and another paper at the, and you sort of scroll it in. How many of you might have seen any of that gadget? Well, unfortunately, I've given up my age. Or fortunately. That lady today is not there in our workplaces. That role of secretary, the traditional secretary, is not there today. We have had to adopt her role in what we do. So we do not have people who are taking for us minutes. When you go for meetings, you take for yourself your own minutes. Isn't it? In your laptop, on your phone. That lady is no longer there. That she's going to come around with a hard copy and give you a copy of what you discussed. Because you should have already taken your notes on your phone, on your diary, on your laptop. My point here is this, that with our professionals in healthcare, it is also time that they also adopted that they need to embrace patient experience or customer experience standards in their delivery of service. No longer should it be roll up your sleeve, nataka kukudunga shindano. It should be, this is what I'm about to do, this is how it might feel, this is how long it will take, and you have no cause of alarm. Do you have any question? And only after that, then proceed. So that is a challenge in itself. So even from a strategic point, it becomes quite a challenge in terms of trying to convert that. And of course, within the area or region we are in, we have regional or cultural resistances that we sort of face. We all come from different communities. So that also plays us a part, because you have to be culturally sensitive to whom then you're engaging with. So those are some of the challenges that, that are there. That doesn't mean that then it's all doom, because the beauty with when we were talking about the silos of data is that now we're starting to see means and ways that we can be able to merge these systems. I'm pleased to be working or to be served by Riana, where we're now looking or have merged some of these systems in terms of feedback for patients, in terms of complaints, and finding means and ways to merge all of this into one, rather than have 2 different tools or 3 different tools. We're still far from where ideally it should be. So I think the overcome here is the collaboration to explore of how then do we integrate this data and remove the data silos. In terms of the professional challenges we have of adoption of CX standards, we just have to preach. We need to also come together and put in standards. We need to have trainings that are customized for the healthcare industry for patient experience. So that is what I see in terms of an opportunity. In terms of culture, we just need to be sensitive about them and be able to empower our teams in terms of knowledge and how then to overcome that. Thank you.
Well, thank you so much, James. We'll now come to Vidiana. And I'd really like to hear so much about what you're doing there. I remember we had lunch on Friday last week, and we talked a little bit about this. But how are you using customer service or some feedback to drive service excellence and improve customer lifetime value at Acorn Holdings Africa? And also, what role does digital innovation play in the real estate customer experience?
Thank you, Moses. Good morning, everyone. I believe it is still morning. So I'll give you a background. For us at Acorn, we have the Kwetu brand, Kejani brand, and we are home to over 6,000 students. So you can imagine the amount of the volume of feedback that is coming in. We started a long way from just having properties that we thought were best suited for the students, only for them to come back and tell us, you know what, this property is amazing, it has the amenities we love, but it is far from our institution. How about you guys, just move closer to where our institutions are? And we did listen to them. We also started with rooms that we thought would be suitable for them. We initially had 3 rooms. Now we've moved to over 14 room types. So there is always something to pick and something to learn. And for us, it's been a journey of working with the students, listening to them, collecting feedback. Normally we run some exit surveys, some things that we really do think are not too important because maybe they don't touch on the student too much, like security. You find that they are truly paramount for them. They want to be in an environment where they feel safe and secure. So for us, we have to ensure that we are bringing that space, we are bringing that security feature for them that is easy and accessible. And just from the use of key cards instead of biometric entry and simplifying the onboarding process. I know when you're making a reservation, we want to have a virtual tour. We want to be able to have flexible options of payment. So we deal with a lot of international students as well. So we are able to just take them through the onboarding process without them physically being here. And when they get here, they are only coming here to check in. So they will have a virtual tour. They will view their room and select the room that they like. They will even make payment because we have integrated payment solutions. They will upload their documents. They will even sign their lease digitally and check in into the property. And once they come in for the physical, now we can carry on with the other things. Because like Mitch said in the morning, we cannot completely remove the human from the interaction. As much as we are also digitalizing everything we can, we also have a human touch and a face when they come to the properties for them to relate to. So for us, in terms of customer life cycle, again, from feedback that they've shared, they love the space they stay in, it's convenient, but when they are done with school after the 4 years or 6 years of study, where do we go? So as an innovative brand, we are looking into other options of rental communities that we can come up with. We'll initially be starting off with the young professionals as we transition them to other spaces, but we are looking to having them for a lifetime. Thank you.
That's so interesting. So what you're telling me is that if today I was a Gen Z, potentially, I was in USIU, by the way, so I've seen the massive complex you have nearby.
Yes.
I could potentially have been in school with you, and then when I'm starting my career, you have the next generation of accommodation or housing facilities coming. Is that correct?
Yes, that's the plan.
So you're just like a bank now. You're going to keep the customer for life. I hope KCB is taking tips. Huh? Yeah, great.
Thank you.
Bernard, my good friend, Gava. Yeah? So the adoption of CX technologies, and I'm saying this with a lot of respect and sort of like the way I've been so impressed with what Ranav shared with me, what you guys are doing. Looking at BRS, more importantly, how have you managed to implement the various propositions that, typically people think government is probably the last place where CX would happen. But what have you guys done at BRS, and what sort of implications have you seen from that, and what sort of impact have you had with your stakeholders through the deployments that you've done from a CX perspective? But also, we know that culturally, sometimes this is a challenge. Again, the historical reputation of Gava. But of course, this is Kenya, where eCitizen, is one of the digital first touch points that we use with government for everything. So please give us your perspective, because I think you have, the experience of working in BRS and other organizations where I've worked with you. Please share that story with us.
Thank you so much, Moses. Now, let me start by saying that at BRS is where we birth a business. At BRS is where we work with a business throughout its life cycle. It's also at BRS where we bury that business when it has outlived its purpose. When you look at all this ecosystem, CS Technologies is at the center of it. We are dealing with human beings, all right? And BRS is a critical player in the business operating environment. It's therefore expected of us to be very efficient in our service delivery. You've already mentioned eCitizen. I think we are the #1 government agency that is fully automated from end to end. What does that mean? People expect not just the normal service, they expect you to exceed that expectation. Now, to address issues of resistance and culture, I think during the inception of BRS, I think it was a blessing because we had a very board of directors who are very intentional about customer experience. When you get to our website right now and you look at our purpose statement, it tells you that we purpose and we are there to serve customers in a more responsive way, that they're able to feel that they're dealing with human beings. We've been in government institutions where you call, people don't answer your calls. But BRS, we have been very intentional that we pick that abandoned call and call back the customer to find out, was their issue addressed? But most importantly, in our strategic roadmap as BRS, we ensured that customer centricity and customer experience is anchored in the strategic roadmaps. And as I sit here on a quarterly basis, I submit reports to 2 committees of the board, clearly indicating what measures we are taking to enhance customer experience. With that happening is that from the support staff all the way to the director general, every person is taking a role to ensure that customer experience is at a level where we envision. Additionally, customer experience, and to ensure that we don't get resistance, I think Mitch indicated about empowering our staff. We are continuously, with the data we are collecting, identifying the gaps, but continuously retraining our members of staff. We need to empower them. And at the end of the day, we are walking within the same road. Finally, I think in that regard as well, we've ensured that we've cascaded issues to do with customer service and customer experience to performance appraisal and performance targets of each and every members of staff. So what it means at the end of the day, At the end of the day, if it's cascaded to your performance targets, you have to be customer-centric and you have to serve the public as they are expected to be served. Again, as I finally say, because people say Gava and people are laughing. As a government entity, we are a public trust. When you come and seek services in government, you are not coming for a favor. It's your right. And with the Gen Z and the social media digital activism, we are forced to up our game on our daily basis. Thank you.
Can we campaign for you to become the CS Director of Government? The way you've spoken and the way you've emphasized the transformation is incredible. But here's the thing, I want to ask you one more question. I think especially for those who might want to see how this is, given your experience, what about other government agencies and arms of government that, let's be honest, are not doing well in what this is all about? How would you recommend or suggest to them to start this journey and do it well?
Thank you about that question. I think recently the government initiated an academy at the Kenya School of Government where it will be cascading trainings from the top level. And I think they started with the CSS and the PSS for those who are in the online platform, so that the same training can be cascaded down to all levels across government. I know my colleague Sheila there from KRA and we are discussing. Sometimes we tend to beat government too much, where we sit, indeed, but then there is room for improvement, a lot of room for improvement. But most importantly, the issue raised, there is an issue of attitude. So whenever we set targets for these members of staff across board, we look at the procedural dimension and we look at the personal dimension. Procedural are the systems and what we put in place, but also there is the personal dimension. You get probably they have the wrong attitude. So how do we ensure then that we put people with the correct attitude as the front-facing staff to ensure that they provide that excellent customer experience?
Fantastic. Thank you so much for sharing that. I feel like we should almost have Sheila join us on the stage, but by the way, if you go to KRA nowadays and interact with them, I'm sure you guys can tell a huge difference from 10 years ago, right? And I think it's thanks to people like her. So Gaba is on the CX program, for sure, for sure. So Monica, how are you?
I'm fine, thank you, Moses.
Karibu sana.
Asante.
So how are you guys at Aga Khan, of course, and of course I know you in a previous life at another healthcare organization. How are you integrating customer experience into the healthcare to improve patient outcomes and also satisfaction at Aga Khan University Hospital? And also, what are some of the CX strategies you've implemented to drive operational excellence?
So thank you so much, Moses. And I'd also want to thank Ranaf and the entire Riana group for organizing this event. I think we need to keep having more of these interactive events. So when you think about healthcare, it's a little bit of a different space. And by the way, in healthcare, we don't talk of the customer experience, we talk of the patient experience. And when you're coming to a hospital, it's not your best moment, you're actually suffering, isn't it? Yeah, so when you're coming to the hospital, when we're looking at patient experience, what do we want to do for you? We want to reduce the amount of suffering associated with receiving care. Isn't that the case? Yeah, so what are the pain points when it comes to healthcare? Wait times. I'm sure you can all testify. How many have waited 5 hours? Yeah, so wait times, that's really a pain point for us at the hospitals. The other thing is optimizing our communication channels. So you'll find the front office person is the same person serving a patient in front of them, and the phone is ringing, you're trying to book an appointment. So is this a person supposed to pick the phone, or are they supposed to serve the person in front of them? So those optimizing our communication channels so that we make it easy for you to book, access, and get the information that you require. So that's another thing. And then the other thing is transitions in care. In the healthcare industry, it's really complicated because we have very many players. By the time you're getting to see the doctor, you've passed through so many hands. Yeah. So that's the whole spectrum that we're looking at. So in Aga Khan, to be specific to your question, we've done a lot of things, which I'm going to share with you today. But one thing I'm going to tell you is that there's no magic bullet when it comes to patient experience. It's a lot of Like Mitch said, you have to be agile. There's a lot of iteration. You try something, you have this brilliant idea, you think it will really change and move the needle. It doesn't. So you have to be resilient and really keep trying. So I would actually summarize and say in Aga Khan, we focused on 3 areas. So the first area is people. The second area is our processes, and the third area is technology. That's where Riana Group comes in. So when I talk of the people, I think Mitch alluded to that in your presentation, leadership endorsement. That's very, very critical. If the leadership is not supporting CX, patient experience, if they're not resourcing it, if they're not passionate about it, then it's very hard to create that culture. So at the Aga Khan, I would really say that our CEO has been Mr. Rashid Kalani. He's been very passionate about that. And that, when it starts from the top, then it does trickle down. Then the other thing, when it comes to people, we are the leaders. Most of us are the leaders sitting in this room, but we are not the ones giving the patient experience. It's the people who are under us, yeah? So as leaders, if we are not taking care of the people who are actually giving this service, yeah, then no matter, even if we go to the rooftop and shout about patient experience, it will never come to life. So for us as leaders, I would say take care of the people who are taking care of your patients. Yeah, are your people well-resourced? Are they well taken care of? Are they supported in their work life? Of course, we do the trainings, but also making sure that your employees are well looked after. As someone who's joyful, have you ever been served by someone joyful? It just rubs in on you, isn't it? Yeah, so take care of your staff. So when we come to our processes, hospital processes are complex, like, it's not very easy. But so one of the things that we look at, and I think we are famous for, is of course our accreditations, JCIA. For a hospital to run, you need to standardize your processes. So that's the first thing, and that's why we do all these accreditations that we do. The second thing, when it comes to wait times come because of what? Because of the bottlenecks, isn't it? Because people are coming at the same time, lots of people, you have to serve all of them. So we have to look for ways to decongest these numbers. So we do this through our outreach centers. We have 53 outreach centers, and that's how we manage to decongest other patients. The other thing that we do in terms of decongesting is telemedicine. Mitch again talked about the pandemic era. We had to innovate. There's a time when you wouldn't do a Zoom call with the doctor, but nowadays it's a common thing. So we do telemedicine. We do, if you want medications delivered to your home, why not? Why do you have to go and queue in a pharmacy for 2 hours? We do that. If you just need a simple blood, like there's a 2-week thyroid test for newborn babies. Why do you have to carry your newborn baby 2 weeks to queue for 2 hours in the hospital? Just call us and we come and bring a phlebotomist to your house and we draw the samples. So those are some of the innovative solutions around what we've been doing. And then last but not least, speaking to Riana Group, these guys have been our core partners. We have QCs in our hospital, and it's been working wondrously. So it's helped us really manage the queues and create predictability. Then the feedback system, I don't know about you guys, but we used to do manual feedback before. Where you tell them you have to give us 20% feedback, and people would sit and write. The bad feedback would never come to us. But now with the QR codes and patients have to scan the feedback, we are getting authentic feedback. We thought we were the best, and all that. We used to score 99%. But once we got the QR codes, we are getting authentic feedback. We are hearing the raw feedback from patients, and we are able to pivot.
Well, thank you so much, Monica. And I think many of us who are your customers, or is it your patients over the years, I think we can see that it's like night and day. From, as you said, from driving in to getting the service is incredibly improved. So definitely we're seeing the fruits of your labor there. And of course, the implication of using systems like Riana and QCS from Calvin, really giving us a much better service experience. Thank you for that. So finally, we come back to Joseph. Joseph, Stima Sacco. In financial services, especially within Saccos, which in itself is a bit of a unique space, how important is data-driven decision-making in improving customer experience? And also, can you share an example of how Stima Sacco has turned insights into better CX?
Good morning. Thank you, Moses. And let me start by saying that we come from a very competitive space. If I'm to ask ourselves here, how many of us have bank accounts or you are customers of financial institutions? I know everybody will lift their hand up, okay? So we have to rely on data. We have to keep with the times, and we have to do a lot of changes. So in the case of the SACCOs and Stima Sacco, over time, we have considered the SACCOs to be behind there in the financial institutions. So, of course, we consider that the banks are above there. Then, of course, we have other financial institutions like the microfinances, we have the fintechs, we compete with mattresses, for those who know what I mean. We compete with Chilocks. We compete with who else? I've seen we are quite a number from the financial sector. We also compete with the family members who borrow from you. Or who you borrow from, right? So we have to keep on changing. We have to offer the best. When you are saying that you are the industry leaders in terms of SACCOs, by saying so, for those who don't know, Stima Sacco is the second biggest in Africa. Okay, we are headed to number 1 soon.
How many members?
With over 200,000 members. So, of course, considering these, like if you offer not so good experience to your members, they will just shift to your competitor. You have to keep on giving out the very best. So in terms of data, I usually say that if you go to a meeting somewhere and people, are arguing with facts and you don't have data, you'll just be a noisemaker in that meeting. Because people are producing facts like this is how our customer base is and this is what they want. You don't make emotional statements like our customers needs this and you don't have anything backing that. So in Stima Sacco, we have relied a lot on various tools, one of them being what Riana Group provide, the queue management system, just to get insights, get these data, and know where to improve or what to bring on board in terms of products. It's important to know that in the SACCOs, if you are to walk into any SACCO, you will get a loan that goes for 1%. Any SACCO, 1% per month. I know it's really a dawn to the banks and other financial institutions because it's very affordable. But why is Stima Sacco having a loan book of 45 billion, yet another SACCO giving out the same loan or the same facility has a loan book of less than 100 million, despite us being age mates, okay? So it's upon how we are offering it, the various options we are giving to our members. For example, if you're coming to the SACCOs, there is a loan we call guarantors. You want to take a loan and you have to go and get around 4 or 5 individuals to sign for you. And in this economy, especially when you are taking those big, big numbers, then you won't find anybody to sign for you. So what happens, we have introduced various securities that people can choose from, okay? Up to and including corporate guarantees, which is a thing that was just a reserve of the banks. So, of course, we get these from insights that we get from our members, the feedback that we get from our members. Right now, we are getting this feedback, especially from the walk-in customers instantly. A customer is served and they're able to give us raw feedback, as my colleague mentioned. Because whenever you expect them to go and maybe give feedback after a day or when you shoot those surveys, then their tempers can have cooled down. So we want it as hot as it is. Then with that, we are able to tailor make our products and serve our members in a better way. Thank you, Moses.
Okay, great. Thank you so much. So at this point, in the interest of time, I think we'll take one or two questions from the audience. Anyone who feels they would like to ask the panel a question. I think I saw one hand going up. Is there another microphone? If not, I'll just pass this on to you.
Thank you so much. My name is Jane Mino. I work with Kenya Wildlife Service. My question is to Bernard. Given that I work with government, I want to ask you, what do you think it's making us struggle when it comes to CX? Is it really the attitude? I think there is more. And then given that I work with KWS, that's a conservation body, which are these CX technologies you'd tell me to go and employ in my place of work? Thank you.
Thank you so much for that question. Now, number one is the leadership has to be intentional about customer experience. If you don't have the support of the leadership, the failure starts at that point. Number two, as a government agency, just to reiterate, you have to ensure that this customer experience and customer service is cascaded to each and every member of staff. And I wish to say that customer experience is not a formula. Customer experience, and I think Michelle said, number one is leadership. Do you have the support of the leadership? Number two, do you have the requisite technology, or are you implementing technology haphazardly? Number three is the human touch. You might have the technology, but you are not you are not humanizing your service delivery point. But number four is the uniqueness. You'll have different customers in a different day. Today, one of your staff will wake up not in a good mood. But does that mean that they have to treat the customer in a bad way? No. So you have to be unique on how you serve your customer on a daily basis. But lastly, I wish to indicate that in government, the aspect of attitude is a very critical component that you have to address. If the culture is wrong, then you get it wrong from that point. So you have to ensure that every person is on board and that you are working towards a particular direction as an organization. So that is what I could just highlight as issues that you can consider. Thank you. The CS technology, when you look at BRS, we have different technologies in place. We have the queue management system that Riana implemented. We used to have brokers come and solicit money in our banking hall. But for me, it was very clear, no ticket, no service. And the brokers ran away. Yeah? So number two is the call center. What kind of technology are you using? Is it able to provide you with data that you're able to make decisions? Like at a call center, we're able to analyze that data and we know this is the problematic service. What do we need to do to improve on it? When you look at our systems, our registration system on the e-citizen portal, it has to be up and running on a daily basis. My colleague from IT is here, Denise, and he will tell you the minute the system is down, we don't sit down because it's hit and hit. Somebody's bidding for a tender and they want a CR12 and the tender is closing at 4 p.m. and they can't get that document. Do you know what that means? People are agitated. They'll give you all manner of abuse on call. So again, it depends on the kind of systems that you are using and how best you use that data to make key critical decisions.
So it was just a wild thought that came through in line with what he mentioned in terms of technology. I mean, clearly at KWS, of course, the animals are not your key customer. I mean, that is the key attraction for us. But imagine when you're coming to a park, you know, there's a lot of data you collect when you're paying to enter the park. For instance, would you have solutioning around, you know, who is in a particular park at any given time? Let's say if you're going to Nairobi National Park. So you know a certain number of people are in there. Now your wardens and rangers are inside the park. So maybe they know where the sightings for certain animals are, like the lion, the rhino, and you name it. So if you know I'm in the park and I have that interest, why don't you use that data to convey back to me through maybe a messaging system and tell me lions have been sighted at Leopard Gate Park or this particular Fisi area. So instead of wasting time just rotating around the park looking for a lion, yeah, and burning my fuel and just seeing antelopes, then yeah, you can clearly just send that feedback back to me because you already gathered data at my point of entry in the park. It's just a quick thought that I have, and I know someone here can solution that for you.
So good afternoon. My name is Purity from Airtel. My question again goes to Bernard. I just wanted to know if you have any processes in place that can support us as your customers when it comes to like verification of company details. Right now, it's a very competitive environment in the telco industry, and we are starting to see customers out there trying to misuse information for companies. And unfortunately, by the time you realize that this information was not actually correct, maybe something has happened that should not have happened. Do we have APIs like maybe the government database where we are able to verify individual details? Do we have the same for corporates?
You can't be able to verify the information of any business. We have a service called Official Search. As you're all aware that company records are public records. As much as we'll not give you all identifiable information such as the phone number, but we should be able to query the system. Like if it's for a company, you should be able to pay 650 to get the information of any entity. If it's for a business name, you should be able to pay 250 and get basic details of that entity. The name of the entity, the number of the entity, the location of that business, the owners of that business. We have what you call beneficial ownership information. That is only available to competent authorities. By competent authorities, I mean investigative agencies, KRA here, if they need that information, you can provide to them. But then we also have API for businesses. You can exchange your contacts with my colleague there, Denise. You can raise your hand. You can schedule a meeting and see how best you can get the API. We are actually in the process of looking how best we can have this API available for private entities, but it's a discussion you can pick up with him if you are doing large verification of business entities. Thank you.
Thank you so much for that, Bernard. Bernard, it's interesting to see that you are the one who has really answered a lot of questions. Again, Gava is winning. So in the interest of time, I think I'd like to give the panelists a last opportunity to give us their closing remarks in a minute or less. And each panelist, please give us a summary of your key takeaways and predictions for the future of CX, which I believe will answer the question from the lady from Crown Paints. And where do you see the trends and so forth going? So starting off with you, James. In a minute or less.
Sure, Asante. I think the elephant in the room is AI, and that is big. But it's also good to demystify this AI, that the trend being that the data needs to be meaningful for you. I give examples of, say in healthcare, where you're being discharged, and I spoke this at a different forum, a doctor comes and sees you, say, at 8 a.m. if you're an inpatient, and you're happy that they tell you you have been discharged. So the immediate thing in your mind is to start packing your bags, isn't it? But at what time does somebody come to you with a bill? Yeah, it's hours later. You know, little did you know that this same doctor is one who goes around in different wards to tell other patients as well, you are discharged, you're going to stay, and by the time they finish their rounds, it's about maybe 1.5 hours. So they also now again have to sit down and say, James Njoroge, you are discharged on the system. So where I'm getting at with this is that with adoption of AI and systems, imagine a situation where now that I'm having a discussion with you as a doctor, I'm saying, and Mr. James Murore, you're now going to be discharged, and your drugs are going to be ready. This is how you need to take them, X, Y, Z. And through a device that the doctor is also speaking to, at that same moment in time, because today you have Siri, isn't it? At that point in time, that intimation of your discharge starts, rather than having to wait that 1.5 hours. So what I'm talking about is that there is more. We need to be very we need to be purposeful in the utilization of this AI in its full effect, that works for you. I truly love the suggestion that Bona Mitch talked about. And I recall when we were in the bus with ICX when we had gone to plant trees. And as the KWS team were taking us around to show us a few animals here and there, I was seated close to the driver, and the driver was saying, he was on the phone all the time, but for good purpose, because they were calling each other and saying, Tango 5, enda pale Tango, sijui Tango left, nini. Then the guy turns his bus, and so again, it's about meaningful data. So that is what I see in terms of the future for this, we need to be very purposeful in thinking of how do we optimize on this AI. To the healthcare space, I see there will come a time, and very, very soon, where patients become very, very knowledgeable about their rights. Unfortunately, today, it's sort of like a thing that is, just before the water boils. That's what I see in the healthcare space. Unfortunately, we are running behind in that space. But what I'm talking about is that very, very soon, we will see more people's agitation as patients in terms of the level of service that they expected. We see this in other industries, in banks. If somebody's not happy, they'll simply say, nataka kuona manager, right? On very few occasions do I hear in our hospitals, in the 4 hospitals, nataka kuona manager. But that is very, very, very soon coming. Why? Because I also see, and this is also in other industries, because people have already started being sensitized to levels of service. So they will start asking and demanding of them. So these are the 2 things I'd just like to mention of that. Thank you.
Thank you so much for that. I like what you're saying there, because potentially you're going to turn us into activists as patients. You're giving us ideas. The way that we handle with Mitch, we're not going to bring that to your area soon. So thank you for that. Huh?
Please, thank you.
Yeah, great. Riana, what about you? Looking at trends, future, and key takeaways.
Thank you, Moses. The next generation is really digital. Like for us, 60% of our customers interact with us through the digital spaces. And I know we all have these CRMs that are really working perfectly, and AI cannot go unmentioned, because I think that is the next thing that we need to get into. Those mobile apps, those convenience systems, and I know Riana have this amazing security solution. So beyond the visitor management and the CCTVs you have, what more can you do within the AI space? And for us at Acon, that is something we are keen and looking at. Just as an example, having a fire alarm system that tells you and directs you that please turn to the right and, to access the nearest fire exit to you, do not panic. Because, at that time we are all scrambling to get out of the space. So I believe there are great opportunities, yes, within the digital space, but elevating it to the next level. For us as CX professionals, we have an advantage of understanding the customer journey from end to end. I think the thing would be for us to stretch, add new skills, learn new things, and if they can even be in technology, the better for you. It will give you an advantage over the other people. And finally, let's build communities. I know we have delegated a lot of things to technology. but we can also build online communities and having platforms where we can engage our customers. Remember, it is good to have a frictionless experience, seamless experience, but we want to create memorable experiences. So let's have those online platforms, online communities, online engagements that can bring us together. And this has really worked for us because, you know, our Gen Zs do not want to meet physically. They do not want to engage any other way but digitally. But we've been able to engage them on learning, on clubs, on events, on activities, on talks, on a lot of things. And it's been amazing. There's an opportunity to create impact even within the online space. Thank you.
Coming to you, Bernard, the man of the hour. Tell us about trends, you know, future casting, and of course, key takeaways.
Thank you so much. As BRS, again, we are leading by example. Today, if you are to resign from a company and you're in Dubai or in Australia, you are forced to come to a banking hall and confirm, for us to confirm the identity of this person so that we resign you from the company or transfer your shares. What we are doing now, we are piloting a video verification process. If you are transferring your shares, you don't have to waste so much money and time to come to a banking hall to get that service. So if you are not adopting technology, you are losing the game. The other day I was in town, and there are very many shops selling the same item. But what is the difference between one shop and the other shop? Is how they are utilizing the digital platforms that are available. And for any business right now, is to ensure that you are not left behind. You need to firmly utilize the digital platform. Put clear frameworks in place and procedures. Issues to do with data protection. With this digital age, it's very critical. So ensure you put critical key safeguards in place so that then you don't find yourself in trouble. But what I will say is that if you are not adopting to the new technologies, then you are losing the game. I will say that at BRS also, I think we are like 2-3 government agencies that have chatbots. Because then we are looking at it. Must you talk to somebody as much as you want to humanize it? If the chatbot fails to assist you, then it can transfer you to the call center or other omni-channels. Additionally, as my closing remarks, I will just wish to indicate that even with the digital technologies, there is what we call digital divide. Do not forget that Mama Mboga back in the village who has digital challenges. Ensure then that you have meaningful relationship with key partners. How are you partnering with our stakeholders to ensure then that you bridge the gap and bring this technology closer to this Mama Mboga? Thanks so much.
Great, thanks for that. I love the way you've mentioned the digital divide. So imagine, for instance, if somebody is sitting with a Mulika Mwizi phone and can't access WhatsApp, presumably you have a channel on SMS to deal with them, correct? So you do provide for those who are not as connected as you'd like them to be. Yeah. Monica, please give us your last remarks as well.
Okay, so for the healthcare space, the way forward is on 2 aspects. It's creating convenience and being patient-centered. Hospitals that will not be doing this in the future, I don't think will succeed. So in terms of convenience, people want things brought closer to them. They want ease of access. So telemedicine is here to stay. Home delivery of services. Yeah, why does a patient who only requires palliative care have to stay in the hospital? Why can't we give the care from home? Doctors even coming to see you from the comfort of home. These things are happening. So convenience is here to stay, and hospitals that can innovate around convenience. And the Gen Zs that you're talking about, it's about convenience. They're not going to stay for 5 hours like the way we used to. They want, microwave results. They want you to move very fast. So I think innovating around convenience, that's the space, the way to go in the healthcare industry. The other thing is being patient-centered. I think we've really moved from the era of clearing and forwarding. You're just seeing patients, you're not even listening and you're writing a prescription. People have really evolved from that. Nowadays, the doctor you want to see, is a doctor who pays attention to you, who listens to you, who engages you. And what does this do to you? It builds trust, isn't it? Yeah. And when you get a prescription from that kind of a doctor, then you're willing to adhere to treatment. You're willing to, what can I say, to comply to that treatment. Yeah. So at the end of the day, for me, how I see patient experience, it really, it's a very big conversation, because such things really contribute to the overall health within our country. Because if you think of the pain of going to a hospital and you're thinking I have to queue for 5 hours, I'll be tossed from here, there. By the time you're going to the hospital, it's when you're critical, isn't it? Yeah, and we want people to, go for wellness and you check how you're doing. But the thought of going for your wellness is just excruciating. You have to put a whole day aside. So we really have to think into all this. And when we do that, then we prevent people from having even this catastrophic expenditure that we hear about. Yeah, because by the time you're going there, you're in stage 4, all the money is going. Yeah, but you didn't want to go when it was just a simple lump because the thought of that whole process. So we really need to look at patient experience as a way of alleviating patient suffering. Thank you so much.
Thank you. And lastly, Joseph, please, your remarks.
Thank you, Moses, and I'm lucky to be the last, so I'll also summarize what my colleagues have said. So I have 4 key, of course, I haven't taken just 4 points from this place, but I have 4 key ones. One, I don't know whether it was our keynote speaker who said that we must embrace technology. But at it, we must remember that technology can never and will never replace the human touch. Recently, we have had the Gen Z protests, and I think everybody has mentioned about Gen Zs. There was one Tuesday that there was a lot of protests. Then it died, or rather it went down. I believe there is a reason why the whole thing died. One particular thing, the Gen Zs, okay, I agree with them in a lot of things, but one thing that they were saying that they are leaderless. That's where the problem started, because a leader is a leader. You must be led by, even in a home, you must have a leader, right? So back in our institutions, and I believe here we are leaders, we have a group of individuals that we lead. We must lead from the front. We must set the pace. If it's culture, changing and handling our customers, we must lead by ourselves, and then the rest will do whatever we are doing. Then the last 2, AI, we must embrace AI, of course, to get insights, to handle generic things, and work on the insights that we are getting. And lastly, we are going into an age, or we are already in an age where we are getting instant feedback that can break or make our institutions. Just going back to what the keynote speaker, his last slide where he talked about the United breaks what? Did you know that? The United, I believe it's United Airlines or something, they had a lot of time to convince this guy when he was in the studio. I believe he went to a studio somewhere to record the song, to do the shooting, but they chose not to, right? But right now, our customers, they will never go to a studio. They will just do a tweet that is less than 10 words, and it will break your whole institution. So we must be keen on that and make sure that we are getting instant feedback, so that when a customer is agitated, you're able to act before they go and do the recording of a United breaks what? Guitar. Thank you very much.
Well, to our panelists, thank you so much for your contributions and sharing your insights. I believe the audience here has gotten value from the same. And maybe my closing remarks, in marketing, we often talk about the 4 Ps, which I think became the 5 Ps, the 6 Ps, the 7 Ps. And I think now we're up to, how many are we up to now? 10, almost 10 Ps. But from this conversation today, I think there were 3 themes that I picked up. Number 1 is people. Customer experience is a human thing. And people, whether it's their attitude, the skills, the upskilling, how do they deliver great customer experience is really about the people. And it's not just whether they've been trained and are certified, but what's the attitude, right? Are they in a posture where they are customer focused, or do they see the customer as actually a distraction or a bothersome person? So I think that's the first thing I picked up. Number 2, I think, is platforms. Yeah, you need technology today to deliver high quality experience, even for your non-digital touch points, right? So making sure, for instance, that, as you're interacting with them, let's say in an event like this, or they're coming to your, entry in your office, how using technology or platforms to deliver great customer experience. And then I think lastly, was processes. If you're not documenting, if you're not building processes and systems that actually allow you to deliver great customer experience, which comes down to documentation and getting stuff certified, things like ISO, I think you can't deliver. So I think there's 3 Ps, and maybe I'll be given that accolade of the 3 Ps of customer experience is something that I've picked up here today. But thank you so much for your contributions, highly appreciated. And for the audience, thank you for engaging so well. And more importantly, I hope you've gotten value from today's session.
All right, asante sana.